those who have lost jobs or even lost loved ones and friends. On my first day as a senator, I held a conversation just like this one to hear about the ways that the virus was impacting our communities and what I could do about it as a new U.S. senator. It was important for me to hear from every corner of the state in my first 100 days. We assembled advisory groups made up of leaders from across the state to hear the challenges that seniors are facing, that veterans are facing, farmers, workers, small business owners, and the Latino and African American communities, the issues that they were facing all across our state. I've met with 52 mayors, and I've spoken to leaders in each of Arizona's 15 counties. I met with 8 tribal governments from across our entire state to hear about the issues that Arizonans are facing. And I've taken what I've heard from them and what I've learned from them back to Washington, D.C. And I've introduced 2 bills, both with Republican colleagues and both in response to this pandemic. The first would provide dedicated support to businesses along the border. And the second would examine how to improve the response to the mental health and substance abuse crisis created by the pandemic. I've co-sponsored 12 additional pieces of bipartisan legislation, and I've gotten to work on my committee assignments, including getting to chair a subcommittee on the Senate Armed Services Committee. It's been a busy 100 days and an eventful one in the U.S. Senate. And today I feel hopeful for Arizona and for our country. Yesterday, the president signed the American Rescue Plan into law. And here's what this is going to do. It's going to send $1,400 direct checks to most Arizonans, including children. It's going to cut taxes for working families. It's going to extend those increased unemployment benefits. It's going to get our state additional funding for vaccine distribution. It's going to help small businesses stay afloat. And it's going to provide the funding that schools need to open safely. It's also going to make a historic investment in emergency funding for tribal nations. And it's going to deliver aid to local Arizona governments. It also includes a key proposal that I made a priority to secure after hearing from Arizonans. And that's includes nearly $1.5 billion in federal funding for seniors programs to continue meal delivery and vaccine outreach and caregiver support. I've also introduced legislation that will create this community navigator program to assist small businesses with the application process for the Paycheck Protection Program and other relief, and $500 million to fund water infrastructure projects on tribal nations. Since day one, it has been my top priority to get our state the resources we need to beat this virus and help those who need it most right now. Now, some of that relief, like the $1,400 checks, will come as soon as this weekend for most families. And our state and our country is finally on a strong path to recovery. Now I look forward to hearing from all of you, because all of you have, direct and unique experiences over the last year dealing with this virus. And like I said before we went live, we're not really out of the woods yet, but we definitely can see the light at the end of the tunnel. But there is, more issues to address. So I'm interested in hearing from you. So I want to start here with Paul. So Paul Moore, you're an owner of 3 different restaurants in Northern Arizona.
Yes.
I wanted you to share with us today just how you and your employees are doing.
I think, the quick answer to that is everybody's doing okay. Everybody's healthy. We had some folks get sick towards the end of last year, but thankfully not terribly bad. We went into this last March. We had close to 60 employees, I think, at that time. And on March 15th, furloughed 55 of them. I mean, it was abrupt, and nobody at that time, I think, knew what was going on. And it wasn't something that we wanted to do, but 2 of the restaurants got shut down. The third one, because it has a pretty heavy grocery component to it and was more geared towards takeout, we left that one open and we kept a few people on payroll. But everybody else went on to the enhanced unemployment, which really, I think credit due saved them, and they were able to support themselves and sustain themselves until the rest of the aid and everything could catch up with it with the PPP and all of that. We reopened in June, and just about everybody came back. There was a couple people that had left town, but just about everybody came back. And, we put in place all of the things that we needed to keep everybody safe. And we managed to operate through the summer and into the fall and winter safely. And then, like I said, several people got sick. We ended up closing the 2 restaurants again in December, just out of caution, and kept the third one operating. And those 2 are still closed at the moment. Everybody's existing on the enhanced unemployment benefits and looking forward to coming back. So, we're currently in the process of the second PPP round, and that should be completing for us hopefully in the next couple of days. And, we're going to get back to it the best that we can.
Well, Paul, the American Rescue Plan also includes this restaurant revitalization fund.
Exactly.
Provide $28.6 billion in debt-free relief for small and mid-sized restaurants, which I think you'll qualify for. And it'll provide up to $5 million in grants, not loans, for individual restaurants and caterers, breweries, and up to possibly $10 million for restaurant groups. So, how do you think, do you look at this fund as being able to help you and other restaurants in Northern Arizona?
Absolutely. I mean, I think everybody's realized during this just how broad of an impact our industry has on sort of the greater economy of a town like Flagstaff and across the nation. I mean, there's so many industries that support our particular industry, from distributors to vendors to farmers to, all of it. And they've all been impacted when these restaurants close down. So I think anything we can do to get money into the system to get these businesses back up and running is gonna carry throughout much more of the economy than just our industry alone. Mm-hmm. So,
well, I think the latter part of this year is going to be great for restaurants. Actually, if we can get to herd immunity, 75% of folks vaccinated or having antibodies, I think there's going to be a big demand. People are going to want to get out and get back into restaurants. So,
yeah, and specifically for the rescue plan, I know a number of people in town that had, for one reason or another, were unable to tap into and receive the PPP funds, and so this is an opportunity for them to go for something specific to the industry, which I think will help out tremendously.
Okay. Well, thank you. I want to switch to Susanna Andrade for a second, and I want to talk a little bit about. I understand, Susanna, that you're. I think Susanna's still here. I saw her, and then now I don't see her. So we're going to skip over Susanna for a second, and we're going to go to Katie Nash. And Katie, I understand that you're a teacher and you're a parent of 2 children.
Yes.
What has it been like to be a teacher with the whole new set of challenges caused by this pandemic? And also, how are you a teacher and trying to have all these kids in the classroom, I presume virtually, and then you have your own children to deal with? What has this experience been like?
So part of what I wanted to kind of highlight was that the challenges that we've been facing during COVID aren't new, especially in Arizona. I think all of us are all too well aware of how poorly Arizona schools are funded. And so it just kind of highlighted a lot of the inequities that are happening within our schools from district to district or site to site. some of the issues surrounding food scarcity for our kiddos and having access to nutritious meals, the lack of technology, even in some of our really well-to-do districts. We just haven't had enough funding to adequately prepare for virtual learning like this. A lack of internet. So I know as part of the as ESSER 3 funding, we'll have some access to helping increase internet and bandwidth. And then also just like housing instability for our kiddos. They were struggling with where they were going to live and then how do they actually access virtual learning that way. So I just wanted to like kind of highlight that COVID didn't create these. This has been a problem and it just got exacerbated by COVID and sort of highlighted again, unfortunately. But for myself, I just want to acknowledge I did have a lot of privilege. My mom was able to stay home and is able to stay home with my two daughters. One of them is high risk. So when we went back to in-person instruction, I was extremely nervous about possibly, and still am, possibly bringing it home to my daughter. She had Kawasaki syndrome a few years ago, which is really similar to some of these side effects, things that we're seeing showing up in some students. So my kiddos are lucky that they have been able to do online learning and have the support of my mom, but I know that not every student has been able to do that. And it was a struggle the first quarter. We were virtual together. So I would be live and I'd do my little part. I'd hit mute, run out of the room, go help my kids with theirs because bless my mom's heart, but she's 67 and she doesn't know how to use Google Classroom and, like all of the new technology stuff. And we were struggling, but it did hit us financially as well. Like I thought my kids could get by with a tablet and they needed a laptop. So to the store we went and laptops were in high demand. So there weren't very many. Kind of had to choose a more expensive one than what I would have wanted. But fortunately, we were kind of able to overcome some of those things. We had to increase the internet at our house with having also my husband working from home, two daughters and myself all on the internet. That was a struggle. And I'm fortunate that I did have enough capital in order to make all of those changes, but I know that wasn't possible for everybody. So I just at least want to acknowledge those. But I also want to say that there have been some amazing successes. I had a lot of students who were happy to be virtual because they could have their camera off and they could type in the chat. So it took away some of the mental health and anxiety. There's no bullying when you're online like that. If they're typing, I can see everything that's happening. We can minimize that. Kids who don't.
What grade do you teach?
I teach high school. Sorry, I probably should have said that. I teach high school biology. So yeah, our kids were really happy. They were able to sleep a lot more because they could do their work kind of on their own schedule. Some of our kids were working during the day, so they would access the curriculum at night because they had to work. Either their parent or somebody lost their job. They needed the extra income. So it's really been a community effort. And like I said, a struggle, but also a lot of successes.
Mm-hmm. Did you lose any kids? Like any of them just did not show up for school anymore? I've heard I've heard numbers of about up to maybe 50,000 students around the country or around the state.
And myself personally, I did not, but I know there were a couple of students that we just had a hard time tracking down. I think we did track, at least where I work, there were, we did a decent job of following up with those students. They end up going to charter schools, private schools, homeschool, wherever it was. But it's scary to me. Where are 50,000 students?
Right. Well, thank you. Thank you for all the hard work and supporting our kids. I mean, education, it's our future, and you're right. I mean, we need to do a better job investing in our future, and that means having programs in place and the adequate funding here to support our children's education. Mm-hmm. So thank you, Katie, for all you do, for being a teacher. I want to switch to Susanna. Susanna made it back. So Susanna,
yes.
We lost you there for a second, but so welcome back.
Thank you.
I heard that you and your family were sick with COVID-19 last month, and I'm glad. I also heard you're feeling better now. But how is everybody else in your family doing? And can you tell us a little bit about how this pandemic has affected your job?
My family and I are doing well right now. I cannot say we're 100%. We're still having some healthy issues, some stress. As being a part-time employee, I did not get paid for my time off, and we were home sick for over 3 weeks.
Mm-hmm.
My husband also works for a small company with less than 50 employees, so he doesn't have benefits.
Mm-hmm.
So we were sick, and we were not getting paid for any of the time. My whole family gets sick. My daughters, my grandkid, my mom, she was in the hospital for a while. My daughter too, but they're feeling a lot better today.
Mm-hmm.
My school, my job got very affected by the pandemic. As you know, they shut down the schools. We didn't have the children. I work as a cafeteria worker.
Mm-hmm.
Then the school decided to start offering summer lunches to go. We start making lunches for needed kids. Not everybody volunteered to go back to work. I did. So that's what I felt so bad when this happened, when the school didn't pay us or my husband's job didn't pay, because we were there. We worked the whole year. We hardworking people.
Mm-hmm.
We were making sure, going to work every day, we keep America running. We were essential. We were feeding kids. And it felt kind of like a betrayal for us, not sit at home, being sick, and then find out that our financials were going down the drain because we live check by check.
Yeah. Susanna, were you receiving unemployment benefits during that period of time?
No, we did not receive any unemployment benefits. Later on, the school gave us some like a month later, they give me like a $500 check. It just for the time, I guess something changed in the system and they decided to pay us. So, but my husband didn't, but I did get a little bit of help from the school later on.
So you were working full time for the school district?
No,
part-time.
The cafeteria workers, we're all part-time. So we have no contract and we have no benefits. Okay. We just work 25 hours a week.
Mm-hmm.
We got affected. We have to start making lunches. And we also become witnesses of all the struggles that my community was going through. Mm-hmm. Working in one of the poorest districts in Phoenix, in South Phoenix, we see the number of people grow every day of getting lunch. We were serving in the beginning, we were just serving breakfast and lunch. And then they added dinner and a snack because it was so many people coming over. It really hurts me every day. I see so many stories, so many kids that are hungry, so many families coming. It seems like the number gets bigger every day.
Yeah.
I wish I can do more, but I can't. The only thing we do is we take pride of what we do. We make the lunches presentable. We pack everything carefully, and we treat everybody with compassion and respect.
Mm-hmm. Well, thank you for what you do, and my hope is that the direct payments to the families, to your family and the families that you serve, will be helpful here in the coming months. So,
and I hope that too.
And those should start going out here within the week. It'll take some time to roll those out across the country for everybody who is eligible, but folks should start receiving these in their bank accounts here soon.
And I feel very good about it, but most of our community too, some of them do not qualify for the stimulus. Some of the kids do, some of the kids that we deal with don't. And some of those people are homeless or they don't have a direct deposit. They have to wait longer to get their money.
Yep, understand.
And that's what I joined this organization because I thought we needed to do more for them.
Mm-hmm.
And I also realized that I needed to do more for me. I did apply for a new job at the school and I got it. I'm starting a full-time job tomorrow with benefits and a contract. So I'm very happy for that. And I think better days are coming. And I hope you can do something for our communities in South Phoenix, for our children, that's the future. And it's really heartbreaking to see kids hungry. I think no one should be hungry in this great country that we live in.
Well, you are absolutely correct there, Susanna. And thank you for all you do, and congratulations on your new position with the school district.
And I just want to thank you for listening to me today.
All right. Well, thank you.
I'm a big fan of you.
Thanks. Thank you. Well, I want to go over to Marquita for a second here. So and I'm pronouncing that right, Marquita?
Marquita Gishel.
I was close. Marquita Gishel.
Yes.
So Marquita, you're a teacher in the Chinle Unified School District, which is one of the largest school districts on the Navajo Nation. And I'm not sure if I visited a school in your school district, but I have been at a school in the Navajo Nation. I'm trying to remember exactly where that was. I think it was Tuba City.
Oh, okay.
Is that in the Chinle?
Yeah, that'll be.
Well, maybe I came to your school. Anyway, so can you tell us a little bit about how the pandemic
west of Chinle, about maybe.
Okay.
I'm sorry, it was choppy.
Yeah, no, that's okay. And we're going to get that fixed. We've got money in this COVID-19 relief bill for broadband on tribal nations. And President.
Oh my gosh, yes.
President Nez and I have had this discussion a number of times. But can you tell us a little bit about how the pandemic has affected you and your students, and what has this /year been like?
Okay, so yes, I'm a mother, also a teacher here in Chinle. I'm from Lukachukai, Arizona, and we serve a high school. We have 2 junior highs. We have 5 elementary schools in our district, and we serve thousands of kids in our district. So yes, it has been a rough year for us since this whole started. We sent our students off saying, we'll see you next week after spring break. And, coming to know we started virtual learning. It has been a process for teachers and students learning to learn everything on virtually. Laptops. We were fortunate when the pandemic started, and into our year this year, we were able to get laptops for all of our students want to learn, but then the Wi-Fi, like what's happening now, it gets choppy, and they're like, Ms. Gishel, I'm back. It goes in and out, and it's been a struggle in that. Our students are trying to learn at the same time. They have their backgrounds. They have students. They have their own brothers and sisters, siblings who are in class as well, at 5 to 6 students per household, and they're struggling. Okay, they want to get into class, but it's hard. The internet connection is very difficult, what's going on right now.
It not only affects education, it affects everything. It affects business. It affects healthcare.
Yes.
It affects the economy, essential services. Everything is, we're all now, connected, and the bandwidth, really matters. And it's the difference between a kid being able to get an education and not. So it needs to be fixed. And
yeah, our elementary students are in class in the morning. All pre-K to sixth grade are in classes in the morning. Then they get off, and then our high school and junior high students come on in the afternoon. We can't all be on at the same time. So we're like half and half, and then we have our asynchronous class and our synchronous classes throughout the day. So our students are they're hands-on learners. And this being in front of the screen for this long is insane.
Yeah.
And for the same, us teachers and parents, I have two high school students in my home. I have an elementary student in my home. So having to, fight over the Wi-Fi, it's pretty much, but we still have our positives. Our students are working very hard. We have expectations for our students, ourselves, our district has expectations. We try to put everything forward as far as our instructional plans, our student works, our assessments, making sure that we're making engaging our students, making sure that they're in there, ready to learn, doing their best, making sure that our environment, our culture in our classrooms are to where they're going to be comfortable to trust us as teachers to work together virtually. We're not able to be there with them, but, they come on, and that's what gets their day. I think it was winter break. They said, Miss Gishel, we miss you. It gives them, allows them to, get away with what's going on in their homes. Most of our students, they want to go to school because, it's someplace sometimes in some cases safe for them. And they have their meals, they know that they're going to eat something. And it's very tough out here on the reservation, being able to try to have the needs for our students to make sure that they're well kept and, try to be there for them.
Well, the legislation that the president signed yesterday is a historic investment in tribal nations across the country. And some of the issues that you're facing now, we should be able to go a long way to trying to resolve them and get back on track, including the rural broadband issue and other infrastructure issues.
Yeah.
That the leadership on the Navajo Nation will have the resources to make investments in the future. So, Marquita, thank you for joining us today. I want to switch over here and speak to Casey Crowley for a second. Casey works at the Chiricahua Community Health Center, which I visited about a year and a half ago. I think I was down there, and met with the team there and the executive director, and I know how much of your work there is focused around the care management of patients. How has this pandemic impacted your work, and can you tell us a little bit about Chiricahua, the health center's efforts to distribute the vaccine? And I understand you guys got some good news the other day, which it's good to learn of that.
So good morning, and thanks for having me. So I am a registered nurse, and I live and work here in Cochise County, which is the southern eastern border of Arizona. And thank you for visiting us last year. We were really excited to have you. I don't think I got to meet you personally, but a lot of my team did. So thank you for making it down here. I just wanted to echo really quick that I am a mom too, and when the pandemic hit, it affected that my children had to stay home also. So I hear your guys' struggles, and yes, we made it through, and like the senator said, thankfully there is a light at the end of the tunnel. So I wanted to talk a little bit about, how my work was affected and what Chiricahua is doing for our community. Primary care nursing is based around education and providing screening services for patients And when the pandemic hit, that it shifted our whole work to initially how we were going to screen for COVID-19 and testing and doing mass community testing. And we are still providing those services as needed to our community members. We also saw where COVID-19 impacted us as a rural community because we don't have the resources in large hospitals as some of the other communities in the state do. So a lot of our members had to be transferred out, as far as Flagstaff or Bullhead City. And it really took a toll on our community because, families weren't able to travel the long distance to be able to provide the support to those members that were hospitalized. And then again, also, I echo the problem with internet services down here. We saw a huge shift from seeing all of our patients in clinic to seeing them via telehealth, which is a great service to provide. And I really hope to be able to continue to provide the service to our patients in the future, even past COVID. But there are a lot of areas in our community that you don't have cell service or limited cell service, which affects, access to smartphones and internet services themselves. So we've had to be really creative with these patients and trying to keep everybody safe, but yet give them the services that they need. And then we are the only federally qualified health center in our county. So that just means that we are able to provide services to everyone, whether they have insurance or not. And so we've taken a large role in providing the vaccine in our community, which is really excited. We're following all of the guidelines of who can receive the vaccine to ensure the most vulnerable populations are getting it first. And we've done hundreds we've provided hundreds of vaccines within our community. Daily, we are offering vaccines not only to our patients, but those in the community.
And my understanding is you're going to get some additional funding for vaccine distribution and additional doses so you can expand the number of vaccinations you're doing each day.
Yes, we are very, very excited to be able to expand our services. This will allow us to hire more staff to be able to get the vaccines out to the community. We're spearheading a large outreach effort to agricultural workers, which will mean we'll actually go out to where they're working and be able to give them the vaccines that they need and are requiring. So we're very grateful to have this additional funding and be able to provide the services to our community.
Yeah, you alluded to it a little bit, that when somebody gets sick in Cochise County in a rural area, they would have to travel to Tucson or Phoenix or maybe up to Flagstaff. So it's this added complexity. So in some ways, you could make the argument that it's more important to get folks vaccinated in rural areas.
Definitely.
At least we want to make it equitable across the state. And I think we're doing a good job at that right now. And the president announced that by May 1st, he would like to see, this is a goal, that anybody who wants to be vaccinated will have the opportunity for a vaccine. The next step here, and I'm sure you realize that, Casey, is we've got to encourage individuals to get vaccinated. This is my biggest fear here, is we get to 60% of the country vaccinated and then we hit a wall. We can't allow that to happen. We got to get to 75%. So we're going to have to start making sure that we encourage people time and time again that this vaccine is safe and it's effective. And when it's available, you should get it, and you should encourage other people to get it. So I'm counting on you to do that in Cochise County.
We'll do our best.
Thank you. Let me switch to Charlotte. Charlotte Richards, who is a OBGYN. Doctor, and she's kind of far away there from the camera, but we can see you, Dr. Richards. Hopefully we can hear you. But you've been treating pregnant women during the pandemic in San Luis. And can you tell us what that has been like and the impact of the pandemic on rural community health centers from your perspective? I mean, you're right on the border.
Can you hear me?
Yes.
Oh, I just want to say, Senator, that my daughter graduated from Scripps College in 2014, and your wife was the subject of the baccalaureate ceremony.
Okay, that's great. Yeah, Gabby's a graduate of Scripps, 1993, I think, and 93 or 94, and she loves Scripps College.
But I'm still talking about her 20 years later. Okay, so I've been here for 9 years. I'm a board certified OBGYN. I actually grew up here, left, came back to take care of my parents. I was on the East Coast for 30 years. So we've been down here for 9 years. We started the OBGYN service on the border nine years ago. We went from 2 of us to 5 of us. So I'm just going to tell you what happened. I wrote it down because I'm nervous. We started waiting last March for the onslaught. It didn't come until May. And when it came, the hospital wasn't ready. They didn't have reverse flow up in labor and delivery or anything like that. And so it was kind of a battle. I almost lost 2 patients to COVID-19. Both of them had metabolic syndrome. They were insulin resistant and pre-diabetic and all that. We did have 1 stillbirth. We did have a patient that we identified as a stillbirth. So let me tell you what happened. It became evident after about 3 or 4 weeks that people were getting too sick before they got care. So I talked to people at the hospital, different colleagues, and actually a very interesting doctor from Mexico who said, why don't you just start treating them before they get really sick? So we did. We started treating people with the various inhalers and steroids and azithromycin. And then we started to add ivermectin, and we started treating people before they got really sick. And I started treating men, women, not children. But so we started to test our patients and by the way, my boss did 90%, Amanda Gary did 90% of the testing in Yuma County. And she still is doing most of the testing in Yuma County. And of course, she's giving vaccines now too, according to the protocol. But we started to identify the pregnant patients and non-pregnant patients who had COVID-19. We were testing them once a month. And as soon as we got a positive test, we isolated them. And then we started checking in with them. When they got symptoms, I started treating them. So we were able to have prevent anybody being hospitalized after about September, even though there was a lot of it out there. And so that's what we continue to do. Fortunately, right now, we don't have any patients with it. I have a few other comments to make. One comment I have to make is that we lost Title X. And because we lost Title X, we had these teenage girls that were very isolated because they couldn't go to high school. They couldn't go to high school online. Some of them took off to Mexico, and grandma couldn't help them with their homework, so they dropped out and they ended up pregnant. So right now, we have 1 16-year-old, 2 15-year-olds, and a 14-year-old. We just delivered the 14-year-old. I hope that at some point we can get our Title X back, because with the Title X, we can offer family planning services to everybody, not just people who are on access in Arizona. The other thing I wanted to say, my colleagues who are males, who are much more computer literate than I am, because I am 65, told me to ask you if you could please put the cable down here.
So, Dr. Richards, you broke up there a little bit. They asked you to ask me what?
If you could have a fiber optic cable put down here so we can get 5G, because we don't think we're going to, well, we don't have 5G, whatever that means, we don't have it.
Yeah, well, you're talking about 2 different things. So the 5G would be the cell phone connection, right. And that's going to be up to AT&T and Verizon and T-Mobile to decide when to do that, and they will at some point. Fiber optic for broadband, is something that the community can make an investment in. And in this legislation that the president just signed, there is money for cities and towns, states and tribes. And some of that money could be used for certain infrastructure projects. And we're going to have an infrastructure bill, hopefully sometime later this year. We need to have, broadband across the entire country. I mean, 99% of the country should be able to access, very high bandwidth, internet connections. And that's not the case right now, especially in rural areas. So, the fiber optic would be great for the Yuma area, and I think it'll be coming. I just can't promise when.
Great, they'll be happy to hear that because we are, as everybody, some of the other people alluded to, we are underserved here with certain subspecialties in medicine, and so we have to do these telehealth conferences, and patients don't want to leave. They have transportation problems, and it's hard to get people to go to Phoenix and Tucson.
Yeah.
So thank you for all your efforts. We're hanging in here. We do have multi-generational families living together, and they don't put mom in nursing homes here. They take care of them in their home. And because of that, a lot of the parents do not want to send their children back to school. They're afraid that their parents are going to get sick. And basically, it was the old guys that passed away. We lost a lot of grandfathers and uncles in the staff that worked in the clinic, and the men wait a little longer to go to the doctors. So actually, the town near the border, San Luis, I'm not sure that they're going to go back to the rest of the year. The parents have some say in it, and they don't want to send the kids back.
Understand.
So, hoping when everybody gets immune, that'll reverse over this.
Well, thank you, Dr. Richards, for all you do, and I want to transition here to Esther Duran, or Duran, I think is probably the correct way to pronounce your last name. Esther, so our seniors have been hit really hard by the pandemic in so many different ways. Can you share with us, what are the top concerns that you're hearing from seniors?
First of all, it's really nice to meet you, Senator Kelly. And thank you for having me. Because I'm quite active in the community, I have come across several seniors, and I am also part of AFSCME retirees. So I think some people don't realize how many seniors are not all on fixed incomes. Many of them have to work in order to supplement their Social Security or whatever pension they might have if they're lucky enough to have a pension. And so many of them lost their jobs during the pandemic. And it was really difficult for them because many of them live alone and they did not have the support of large families, to go to the grocery store for them or take them to medical appointments, that kind of thing. And of course, for the seniors that were at high risk with illnesses such as diabetes or pulmonary issues, or cancer, it was really difficult. It was not just an economic type of difficulty, but it was also extremely emotional. In my family alone, which is a very large extended family, we had 34 of our members of our extended family get infected with COVID. And maybe 3 or 4 of them had to actually be hospitalized and fight for their lives. My brother, in fact, was fortunate enough to be released from the hospital, but he's still at home, still on oxygen, and is going through therapy in order just to be able to walk around the block. And he still can't do it without the oxygen. So it's been an emotional roller coaster for us because being seniors, we know a lot of people, and we lost a lot of people, not just to COVID, but to other types of illnesses and deaths. And we're not able to attend the funeral services for these people. we had to go through the emotional trauma of hearing from one of our relatives who actually works for a mortuary that all the mortuaries were full and they still had 6 semi-trucks full of bodies waiting to be buried. And one of those was my nephew in California, who died on December the 22nd and wasn't able to be buried until February 1st. Mm-hmm. So not being able to even give the family support was extremely traumatic. So for the seniors, it's been both economical and emotional, extremely emotional, not being able to see your children, your grandchildren, especially when your family is large and you're used to getting together at every single holiday and even for birthdays, things like that. So you're used to the camaraderie and the warmth, the hugs, and all of a sudden then you don't have them. Yeah. And then if you add to that the seniors that struggle financially because they lost their jobs that were supplementing their Social Security, it's very trying. And so I can tell you that when this bill passed the last few days, it was so enlightening and such good news for all of us, because even if we are fortunate enough to have a pension and retirement, it's very trying and very traumatic to see other people suffering and, trying to make sure that people are being helped, especially I don't know if people realize that the seniors are some of the most people that volunteer at different organizations. And not being able to go volunteer, like you hear that, Refugee Aid needs volunteers or other organizations need volunteers. And all of a sudden you can't go because either you haven't been vaccinated, or even if you have been vaccinated, you're a high risk. And so it's been really hard. And I can't tell you that this historical bill that President Biden and all of the Democratic administration, Vice President Harris, that they miraculously passed, even without a single Republican vote. We are so grateful that help is on the way.
Well, thank you. Thank you for that. It was no small effort. I mean, it was my top priority and others this past Friday to Saturday. Just for me personally, we voted through the night. So it's the longest I've ever gone without going to sleep, 30 hours.
I know. We've been watching. We've been watching you on C-SPAN. And
voted on multiple amendments. I woke up 7 a.m. on Friday and went to sleep 2 p.m. on Saturday afternoon after the final passage of the bill. And that bill also includes a provision that I got in there and got added because I have the seniors advisory group, and just the stories I was hearing about seniors who, like you say, often have part-time jobs that they've lost and they were struggling to make ends meet. And when you're trying to pay rent, there's a saying out there that rent eats first, right? So you got to pay your rent. And then they were, struggling to be able to buy groceries.
That's right.
This bill, funds essential services such as meal deliveries. It includes $750 million for these new nutrition programs for 2021, and also provides about $37 million to the commodity supplemental food program for low-income seniors.
That's fantastic, because they really need it.
Yep. No, and also vaccine outreach. I spoke to a lot of folks in the senior network that provides services, that a lot of seniors, even though they were eligible to be vaccinated, just couldn't really navigate the system, or couldn't.
Well, a lot of them don't even have computers.
Yeah.
And for example, my sister, she's not computer literate, one of my sisters, and I told her, we'll call 211. She tried and could never get through on 211. Finally, she just drove over to the Cardinal Stadium and told them, I just can't get through and I'm eligible. So they gave her the shot.
Right.
But I'm so grateful that you passed that other bill for the seniors because, like I said, a lot of people don't realize how many seniors that live alone or are still working, have these same problems that all the other population has.
Yes. Yeah. So, like I said earlier, I think we can see the light at the end of the tunnel here. We just have to stay focused. We've got to get folks vaccinated, at least 75%. And we also have to continue to look out for who needs help and then try to put programs in place to help folks. And then hopefully 2022 can be a much better year for everybody. So I want to thank everybody again for joining us. This legislation it does a lot of great things. I mean, including funding for schools and vaccinations and small businesses and seniors and direct payments to individuals and families, folks that really need the help. So I was, very proud to be, part of this in my, just first 100 days in elected office. We're going to get this country back on track here. This is going to go a long way to doing that. And I'm hopeful that 2022 is going to be, the end of 2021 is going to be a really positive year and beyond. So thank you again, everybody, for joining today, and have a great weekend, everybody. Thank you.
Thank you.
Thank you.